My name's Angeliki Vgontzas. I'm a physician. I'm trained as a neurologist and I'm getting subspecialty training in headache medicine. I'm working in Boston at the Graham Headache Center. It's part of Harvard Medical School. In postpartum women, we divide headaches into two big categories. Those with primary headache disorders like migraine or tension type headache, and those with secondary headache disorders, which are caused by things that are usually a little bit scarier. So we'll stick to the first category. So women with migraine are at very high risk for having a migraine in the postpartum period, meaning the first 6 weeks after they deliver. About 25% of women have a migraine within 2 weeks of delivery, and almost half of women have one within the first month. In addition to that, about 5% of women who've never experienced a migraine get their first migraine in the postpartum period. So we're talking about millions of women every year. So that is a very high number. With respect to secondary headaches, pregnancy, there are so many drastic changes that occur in the body. You're at higher risk for things like blood clots. There's changes in your blood vessels and how they're reacting. And you're at risk for certain conditions that can present with headache as well. One of kind of the most common, well-known, is something called eclampsia or preeclampsia. It's a condition where women typically will present with a very high blood pressure, oftentimes will have headache. If that's not caught, it can progress to things like seizures and more dangerous outcomes. So that's a condition unique to pregnancy and the postpartum period. Because women are at higher risk for blood clots, they are at risk for vascular events. What I mean specifically is stroke. So there are a lot of things that we need to consider when women present with headaches in the postpartum period. But the overwhelming majority of women present with migraine. We don't have great data, but as far as we know, the women with migraine their headaches should last as long as they typically do for their migraine. Some women anecdotally will say that their headaches were a little bit worse in the postpartum period. That might be because they don't have as much access to just go sleep in a dark room kind of uninterrupted and let the headache resolve with sleep. But for the most part, there's nothing to suggest that a migraine should last much longer in the postpartum period than when it did during pregnancy or before that. There are some theories behind that. Some women, their migraines are very closely linked to their hormonal changes. For example, some women get headaches right before they menstruate. And that's thought to be linked to a drop in estrogen levels. The same thing happens in the postpartum period, but in a more dramatic way. So when you're pregnant, your estrogen and your progesterone levels are very high, specifically in the second and third trimester. Very soon after delivery, within a few days, those levels drop, and it's thought that that might provoke some of the headaches. There are other factors as well. I think one that we had touched on, you had mentioned previously, was interrupted sleep. All of a sudden there's a new human being who needs to be fed and changed, and typically every few hours. So that kind of sleep deprivation and the frequent nighttime wakenings can possibly trigger a migraine. The common triggers that people have, such as missing meals, increased stress, sleep disruption, those all occur in the postpartum period as well. So even though there's unique kind of physiology, biology behind what's going on, there are a lot of environmental factors that are probably contributing as well. So there's some data to suggest that breastfeeding could reduce the frequency of migraine, actually, or kind of hold it off for a period of time. We don't have a lot of data about it, but we know for sure that breastfeeding does not contribute to increased frequency of migraine. I think it's a very personal decision. You have to look at the overall health of the mother and the infant and the goals for that. One concern I think that women with migraine might have, which is unique compared to other women, is what if I get a migraine while I'm breastfeeding? You know, what do I do? What is safe to take? There's been a great review on the topic that came out a few years ago, actually looking at all the safety data. And there are a lot of different medications that are actually probably not secreted at all in breast milk, or in such a low quantity that they're safe to take. Several of the triptan medications are actually deemed to be safe while breastfeeding. Tylenol, ibuprofen, other non-steroidal anti-inflammatories. Things like Botox or nerve injections are felt to be safe during breastfeeding as well. And actually various preventive agents. So I know when a woman is pregnant, you know, there's a big discussion about should we continue that daily preventative medication. During breastfeeding, the majority of those are actually found to be safe. So I think, you know, it's something that women shouldn't have to struggle with alone. There are a lot of options out there. They do have to be individualized. But for the most part, having migraine should not change your decision about whether to breastfeed or not. So, you know, it's a very stressful time. I think most mothers focus on the well-being of the baby and pay less attention to their own well-being during that time. As you mentioned, sleep is incredibly important. Having sleep deprivation or changes or frequent nighttime wakenings can contribute to potentially triggering a migraine. One thought is to discuss with your partner or close family members if they're able to help you with one of the nighttime feedings so that you could get a good chunk of rest during the course of the night. Additionally, I think kind of creating a plan for if you do get a migraine, what are you going to do? Because you want to make sure you have access to medication. If you're feeling particularly nauseated or unwell, you want to make sure there's someone who could help you out with the baby for that period of time. And kind of running through those scenarios even before they happen, I think is incredibly important. Staying well hydrated is always important, getting regular meals, and taking a little bit of time for yourself for relaxation, even if that's just 10 minutes a day, to kind of sit, reflect, meditate, whatever you need to do to kind of allow yourself that stress release.